I think the moment one says mental health, the picture that we have in our mind is some grim, old, dingy-looking institute in which you have a number of people, individuals confined, who you expect to be either, violent, unpredictable, kind of leading hopeless lives. And it is this extreme stereotype that most naturally leads us to believe that this is something which is not common, right? And that people that suffer from mental disorders are a separate breed of folks. And it becomes like an us versus them, stigmatizing the whole issue. Well, the fact is that 1 in 5 Indians will have a mental disorder by 2020. So it's not something which is very uncommon. And the other fact is that it's not binary. So it's not about either having a mental disorder or not, but rather a continuum. And so today I'm very privileged to have a very distinguished panel here with me to kind of help us unpack a little bit of what this issue is, help us frame it a little bit, and then talk about what are the approaches, whether it's from a nonprofit perspective, a funder perspective, a foundation or a government perspective, on how we can really move the needle on this very underserved area. So I'm going to start off with you, Soumitra, to help us kind of frame this issue, right? What really is mental health? I keep hearing mental illness. How is that different from mental health? What are some of the challenges that we face in this space today?
I think it's important to not conflate the two. Mental health is more than mental illness, but also includes mental illness. You can't avoid talking about mental illness and only talk of mental health without talking of mental illness. But I think primarily, I would want you to not see mental health as a health issue and to start seeing mental health as primarily a development issue. And if you bear with me, I'll try and explain to you why I say that. Mental health is quite closely linked with poverty, or mental illness is closely linked with poverty, so that you have both social causation, you also have social drift. What I mean by social causation, as in people who are poor are more likely to be mentally ill. And social drift meaning that if you have a mental illness, you're more likely to drift into poverty. So you can't actually address the sustainable development goals. And if you're talking about 2030 sustainable development goals, removing poverty, then you can't address poverty without addressing mental illness at all, because there's a huge overrepresentation of people with mental illness among those living in poverty. So that's the first point that you need to know why I call it a development issue. The other issue is things like, I'll give you an example. There's data from India which shows that the rates of unemployment among people with mental illness are close to 60%. In other disabilities, it's not so high. So the physically disabled have unemployment rates about 25-30%. So even among the disabled, the mentally ill are worse off. And something that really gets my goat in a sense is, there's now data from all across the world which says that people who have mental illness die about 15 to 20 years younger than their peers. So people with mental illness have life expectancies which are 15 to 20 years less than their peers. And we don't seem to kind of find that particularly bothersome. And that kind of worries me. I don't know how many of you know, but in the age group of 15 to 29 women who are aged 15 to 29, the number one cause of death is suicide. Okay, suicide now accounts for more deaths in that age group than maternal mortality rate. So we actually control maternal mortality, and we are losing young women to suicide today. So it's a broad range of things. It's health, employment, it's poverty, it's everything. And I think, so we need to see it as a comprehensive whole and not just purely a health issue. Is what I think it is.
Sure. Just to push you a little bit on that, can you, in very simple terms for folks over here like me who don't really understand the space, what is mental health, right? Is it the way we know it to be extreme? What would encompass mental health?
It's a continuum. It ranges from very simple things like somebody having an episode of depression or anxiety I know that Deepika's foundation people are here, and that's depression and that's a mental illness too. To somebody who has a very severe mental illness which results in you requiring admission and treatment in hospital like schizophrenia. There's a recent report, the National Mental Health Survey, which said that 150 million people in this country suffer from mental illness. And if you think of 150 million people and assume that at least 2 family members, then you're looking at least 500 million people in this country whose lives are affected by mental illness, either directly or because one of their family member is affected by it. So it doesn't spare any of us. I mean, if I asked you to put your hand up here, how many of you don't know a friend, relative, colleague who has a mental health problem? Then no hands will go up, because every one of us knows someone with that. It's an extremely common thing that happens to a lot of people, but we've singularly avoided talking about it for some reason.
Right. And if you could then just kind of complete with, you've spoken about the demand side of it, so as to say. What about the supply part of it, right? So why are we not able to cater to this demand?
Well, there hasn't been a demand. There is a need. Let me put it this way. There is a need, there hasn't been a demand. So that many people with mental illness don't actually come for treatment, don't seek treatment. And that's not very difficult to understand why. If you stand up and say you're mentally ill, or if you say I've had a mental illness, in this country you stand to lose a lot. Okay? The Hindu Marriage Act says that if you have a mental illness, that's ground for divorce. You could end up getting a guardian who controls your property. So you could lose your job, and the job protections don't work for you. So saying that you have a mental illness, apart from the social stigma, there's also a lot of institutionalized discriminatory things that happen to people with mental illness. So there hasn't been a demand, and I think that's really the problem. So there is a need, there isn't a demand. So we need to address it in its totality, not just purely say, oh, it's a health thing, here's a pill for it.
Right, great. And so then moving on to you, Rajvi, you lead the Mariwala Health Initiative. We often wonder what makes someone want to give to a certain issue, right? And we heard before, I think Rati was talking about most people giving to education or health, and the larger known parts of it. What made you get into look at this space or give to this space?
I'm going to have to tell you a short story. So about 3 years ago, my father sat me down and said, I want to make a legacy, I want to make a quantum change, I want to be a philanthropist. Can you suggest something? He was actually interested in the 2 sectors you mentioned, education and health. But he said quantum change. I brought up mental health for a couple of reasons. One is it's a priority for me. Going to therapist is as important or as regular as getting your yearly blood work done or taking your car for a servicing, right? But more importantly, as a card-carrying feminist, yes, I said the F word, I approach mental health as a feminist issue. And some of the things that Soumitra went over, stigma, invisibility, marginalization, discrimination, as well as lack of knowledge and lack of treatment. Overall, that leads to an atmosphere everywhere, be it in an NGO that works on mental health or anywhere else, of an atmosphere of ableism and spatially and culturally blocking things off to anyone who may have a mental health issue. And, I had to fight then to prove why mental health was deserving of his attention. Because if I say education, everyone has a picture in their mind, as you mentioned earlier. Not so with mental health. It's amorphous, right? And it's certainly not as cuddly as education. If you're talking about health, there are certain impacts that are very visible. If I do a diabetes camp, if I do a BP camp, the numbers are right there for everyone to see. But that's also where the makhan is, or that's, the low-hanging fruit is there. Education and health, low-hanging fruit, I got it. If I want to make a quantum change, I will do something big in a sector that hasn't been worked on, like mental health. It's grossly underserved, very complex, but it's part of everyone's lived realities. So what's going on? Why is there this silence? And silence is violence. So this actually really struck my father. And what we did then to decide whether we could work on mental health or not was we went on an inciting exercise. And together with a few people, including trusted mental health professionals, we spoke to a variety of stakeholders in mental health for about 7 months before coming up with an action plan to figure out what we could do. Because otherwise, this thing is huge, it's gargantuan, it's like a behemoth. Even right now, we are still looking at definitions of mental health, right? So we found that the potential for innovation is the largest here, which is why we got into mental health.
And you spoke about a quantum leap, right? You said something that we're able to, have a huge impact in. And we heard Mr. Pathare speak about just the numbers, right? What's your approach to be able to match up to some of those numbers to address that problem? Surely it's something that seems
So,
gigantic.
the numbers was part of, I think, actually convincing my father to do this, because if anyone here who knows him or is familiar, volumes are what drives him, right? So the numbers are all there, but I think it took about 7 or 8 months to realize that monitoring and evaluation, assessing an impact is far tougher in mental health, and we are still learning. Once we did inciting, we knew that it's going to be impossible unless we work with government. And there can be multiple ways to do that, not directly, but you can do that through entities you fund or organizations that you work with. So, we're looking at the numbers, but we are also looking at creating that big picture on mental health. It's not there right now. So the opportunity is there for you to do it and really changing the conversation around mental health.
Yeah. And just the last bit around, could you talk a little bit more about those partnerships, right? So I know that you partner with TIS, which is an academic institution. You just mentioned about working with the government. Could you give us a little bit more sense around how you've gone about doing that?
Right. So again, as part of the inciting exercise, we figured out where we wanted to focus on, and we tended to choose projects that have already gone past a proof of concept stage, who are doing excellent work in communities. So we chose to do 5 pillars of mental health, really: training, awareness, research, and capacity building. And so the first person that we partnered with was TIS. TIS has legitimacy. What is MHI doing as a newcomer in this? So we had to choose someone with legitimacy, someone who knew what they were doing, but at the same time, someone who didn't know how to scale up, someone who didn't know how to become independent or sustainable. Before we reached out to TIS, it was a very small field action project. Now it's going to be its own sustainable entity. So we're looking at partners as people who have gone past proof of concept stage, who need scalability, who need core competencies that we have, whether it be capacity building, whether it be reaching out to mainstream media. So those are things that we all know at MHI and we do well. They do their own thing. They're the mental health experts, so we're going to stick by what they're doing. But that's how we chose to approach TIS. Now, what happened as part of the TIS project, as it is happening with a few other projects we work on, is we enabled, in fact, the Tata run, I call helpline, to train at least 4 helplines across 4 different states in Gujarat, Maharashtra, Madhya Pradesh, and UP. So now, other than serving the 1,500 people ICOL serves every month, those 4 helplines are serving at least 1,000 people in a month. And we are reaching out to people in Hindi, Telugu, Malayalam, across a wide range of languages. And as we know, access to mental health is most actually severe for more marginalized populations, rural India, slum populations. So in a sense, we're already working with the government, just creating more capacity. Without working with government on mental health, I don't think we're going to reach those numbers or volumes.
Right. And now that you speak about the government, great segue to ask you, Anand, about, I think, 2 things, right? One is that I think you hold a very unique position because you have the experience of Search, which is a non-profit which has done amazing work in Maharashtra. You are now the co-chair of and advise Tata Trusts on health. And you're also an advisor to the Chief Minister of Maharashtra on health. So in many ways, you're wearing many different hats. and you've seen these different perspectives. How do these all kind of come together, and how do we bring all of these actually, these various worlds really together to move the needle on a sector which is so nascent, which is just starting off, which is perhaps where adolescent girls was 5-7 years back? Your perspectives.
The fact of the matter, of course, is mental health is not a priority for the government. Not that government does not suffer from mental health problems. Last entire month, I am sure every single political leadership was unable to have sleep because of anxiety and possibly depression post the results. But unfortunately, it is still not a priority. How to make that a priority? Well, as everybody would be aware, no script per se, but 4 key learnings which I have been able to have in this partnership is: number one, blessed with a father who has instilled one single dictum in us, is that one accurate measurement is infinitely superior to 1,000 intelligent opinions. We Indians have opinions on almost everything and generally wrong. So the non-profit sector, with true intellectual honesty, suggesting solutions which are evidence-based, fulfilling the criteria of science, I think is one of the best methods to really enter into the arena. Number two, General Eisenhower beautifully said, armies are like thread. You cannot push the thread, you have to pull the thread. Government is exactly like that. Try pushing it. I come from a district called Gadchiroli. Since 1986, childhood, I have been observing the left-wing extremism violence there, which is trying to push the government. No change in 30 years. So you have to pull the government. How do you pull the government? Well, the number 3 lesson I have learned is to be able to manage the 3 laws of bureaucratic evasion. The 3 laws are: number 1, this is not my department's job. Number 2, this is some other department's job. Number 3, this has already been done. And number 4, we don't need it. So if we solve these issues, that would help. And that begs the next 4th lesson, which I personally have learned, is that does it happen that many of us, non-profit foundation, get into in almost a Faustian bargain with the bureaucratic leadership only and have a cynical nature towards the political leadership? In my own experience, this chief minister in 2.5 years has signed more orders on health than last 3 chief ministers combined in 15 years. So I feel it is important for non-profit leadership to engage with the political leadership and to show, and again I have seen that the true pulse of people is with the political leadership, irrespective of whatever we see outside. So I think these 4 lessons are crucial to bring on radar of the government the priority of mental health.
Right. Oh, it sounds very easy when you say that, right? You need to engage with the political leadership. I think I'm going to come to you, Soumitra, before coming back to you on what are your thoughts on being able to engage the government. What are some of the obvious challenges, but also things that will move forward, and what have your experiences been? Because he's clearly saying that, you know,
I
the
totally
government
agree
is
with
open.
Anand. You have to engage with government. You know, if you're going to go to scale, and which is what we all are about.
Which we all
because
agree,
if you want to
yes.
get impact, you have to go to scale. And the one organization which has scale in this country is government. So to not engage with that organization at all would be silly. Engaging with government is a multifaceted thing. Engaging with politicians is one kind of engagement. Engagement with bureaucrats is a different kind of engagement. And then you also have the geographical issue, whether you're engaging in Maharashtra or you're engaging in Gujarat or you want to engage in MP. These are 3 different kind of states. So it's very difficult to encapsulate into one simple thing. I think there's complexity around that engagement.
But how easy have you found it to be able to do that? What are the challenges that you have faced while trying to engage with the government? Because I know that you.
I think one of the biggest
have.
challenge has been what Anand said, which is that mental health and not health in general and mental health is not necessarily a priority for our governments. You know, I mean, there are no votes in health. But the day there are votes in health, then I think our politicians will see health as a priority. So that's always the biggest challenge. The amount of money we devote to health is so low. You know, we spend hardly 0.3% of our GDP on health. Most states, even countries like Bangladesh and Sri Lanka and Pakistan spend 2 to 3%. So, you know, we are actually spending less money. It's not a priority. And then there's a battle between that small money for different people trying to grab parts of it. So I think those are some of the challenges. As far as individuals go, I think I'm going to say this which might surprise people, but I'm actually surprised by the wealth of experience, knowledge and interest that you find in government actually. You know, you talk to the bureaucrats. I mean, I work closely with the central ministry when we framed the new mental health care bill, which is now in the Rajya Sabha. We helped draft the national mental health policy. I mean, there's some really intelligent people. I mean, you don't get to become a secretary in this government, in the government of India, unless you're actually smart, bright, brilliant, and have some interest in what you're doing. So there's a lot of people in there who are very good. I don't think it's people. It's much more to do with the system, the way it is structured, which sometimes creates problems. I mean, that's what I think my experience is. I don't know what Anand would feel on that.
I would just say that if one is committed to work in mental health, it actually sets the tone for work with the government. Because, you know, working with government is like working with children with learning disability. You require the same passion, compassion, patience, and firmness at times. So, in a sense, it is very appropriate field to work with the government, subject to, as I said, those 4 conditions.
Okay, great. So I think last question to you before, you know, we also open it up to Q&A. I know that the government is pushing and doing a lot in the area of health, as you say now. What are some of the things that we can look forward to in, again, a sector as nascent as mental health? I know you've spoken to me before about, you know, the progress that the government is making. What are some of the things that the audience here can look forward to if there's someone here who is sold on this, wants to invest in this? What contribution can they look forward to from the government side to kind of match the investment that they'll be making?
What we are doing, what we realize that when partners wish to work with the government has a terrible autocratic tendency trying to dictate the partner. You do this, you do that, you do here this is how you should do, etc., etc. So one intervention that we have undertaken is that once we know that this is the interest of the partner, let us take example of Tata Trust. Tata Trust say that we want to work on, number 1, strengthening the institution, yes, because that is still an important area of care. And number 2, on strengthening the district mental health program, a good model of primary and secondary community-based as well as facility-based care to the public healthcare system. We actually get a suo motu letter from the Chief Minister to, in this case, Mr. Tata, that dear Mr. Tata, we understand that you and Tata Trust is willing to do this and this in this particular area. We fully welcome, and the concerned department will extend complete support. So it is not the partner coming, but the Chief Minister, the head of the state, inviting the partner to work with the government, which tilts the scale and values of the partnership. So that I can assure on behalf of our Chief Minister is one principle we can follow with any partner who wishes to work in the field of mental health. Second, what could be the specific areas? Number 1, as I said, any institution. It can be our regional mental hospitals, which have 4,000 psychiatric beds in pathetic condition. All the medical colleges, we have taken a policy decision to have center of excellence in medical colleges in whichever field the partner is keen in, and mental health, of course, is a priority. And number 3, if the partner wishes to work with a good NGO and give necessary powers to that NGO to work with the government, that is also completely doable. Number 3 is As I said, developing models through the public healthcare system of district mental health program. Rigorously evaluated algorithms and protocol, take one district and work it there. Government is completely open. Number 3, special risk population, prisons and juvenile justice. Again, we have a program in 5 central prisons. The mental health of the prisoner is one of the key area. And 4th before is substance abuse. Mental health is, of course, the organic disorders, but equally tobacco and alcohol substance abuse. Single example, Gadchiroli district, which is one of the poorest district of the state, the most underdeveloped, has annual development budget of 300 crore. Every single paisa of the government amounts to 300 crore, and the annual consumption of tobacco and alcohol is 374 crore rupees. How can development happen? So working on substance abuse control, substance abuse leading to anxiety, depression, domestic violence, trauma of women, children. I think all these 4 areas government is absolutely open for partnerships.
Okay. With that, we're going to open it up with questions to the audience. Oh, yeah.
Hi, I'm Preeta from Brisbane. Many of us who work in public health have often heard this term, is it an issue of more money for health or is it more health for money, i.e. more outcomes for the money? So if you go to Ministry of Health, they'll tell you, give me more money. And then if you go to Ministry of Finance, they'll tell you that there's not enough absorptive capacity. The government or indeed any other partners are spending a lot of money, but it's not reaching the results or the programs are not tailored for addressing the real issues. I know mental health is particularly complex, not so well known, even in terms of, as you started, Pakzan, what does it even constitute? But this question is maybe to any of you who want to pick it up, which is if you were to have a wish to attract more funds into this sector or move the needle on this sector, which is very neglected and not even understood in India, what do you think might be 1 or 2 things that you can demonstrate? Is there something that we can show in terms of improving people's understanding as to what works to address the mental health issue, which you feel has been underfunded to date or has not been proven to date? So what would be your top 1 or 2 picks to move that needle on this difficult issue?
Okay. I think that's a good question because it's a real difficult one to answer, but let me have a shot at it. I think the first and most important thing is that if you wanted to bring more money into the sector, one of the things that we should be promoting is integration and inclusion. So for example, if you're running a program on income generation, then are we including people with mental illness into those programs? If you're running a program on education, then are you including children with mental health problems into your educational programs? Now, that itself kind of increases the envelope that is available for mental health. So using the integration and inclusion way is a good way to bring in because it also mainstreams mental health as opposed to a kind of siloed, separate thing to be done. Secondly, there's a lot of research evidence which shows that investment in mental health will help. So the WHO just recently produced a report which is available on their website, which basically did an economic analysis of investing in mental health. And they came up with this thing that every $1 invested in mental health gives you a $4 return at the social level. So there's a huge return on your investment in mental health. And the third and most important thing is that there are actually a lot of innovations in mental health which are happening. There are a lot of low-cost innovations which are happening. Many of these innovations have not gone to scale. So I liked it when you were saying that we look at things that have gone beyond the proof of concept and then try to scale them up. So there's a whole bunch of these innovations which across the world and in India are known to be effective, and effective not just in terms of individual outcomes but also in terms of social outcomes. So maybe that's where we should be looking at those innovations. I don't think business as usual is going to solve the problem. Doing more of the same will not make us any wiser than we've been in the last 50 years. But doing something different is probably what we should be doing. I don't know if that kind of tries to address your question.
So like he said, mental health is an intersectional issue. It cuts across class, caste, gender, right? The other thing is that has not been brought up here today that I would like to kind of shine a little light on, is that there's more to sound mental health and well-being than institutionalization and medicalization. And there are plenty of organizations who are doing very innovative work that are driven by this basic premise and are working towards really different methodologies of capacity building within different communities, be it 3 different slum communities in Pune, or Dr. Pathare works in pockets of rural Gujarat and Maharashtra. So looking at community-driven mental health and studying it, you may find it easier to assess impact and the big picture again, the economic ramifications of improved mental health, building resilience within communities themselves as part of a mental health exercise. I think that for me, just taking it a little bit out of the institutionalized and medicalized arena.
Truth is in between, as it is generally. Both lack of finances and poor absorptive capacity, and becomes almost a chicken and egg. But there is no doubt lack of demonstrated model with rigorous documentation of both the processes and the outcome for the government to work with. And as I said, unless we show that, unfortunately, terrible policies will take precedence. We again have this myth in India that we have great policies and poor execution. It is possibly both terrible policies which are bound to ultimately result in terrible implementation. So, community-based program and institution-based program both coming together, but taking it further, not relying necessarily on the government. There I do disagree with many of our friends in the in-quote left arena, is that government solving the problem is more and more a mirage, unless the individual there, as you rightly said, not only medical care, but he is empowered to take care of the issues and understand. So I think hence empowering good non-government organization who can significantly play certain at least service delivery role of the government. You call it PPP, you call it outsourcing, you call it whatever. But establishing that partnership and having the models for the same is a critical necessity.
Really quickly add, in a low resource environment, again, plenty of potential for technology to reach out to more people. The iCall helpline that was mentioned earlier, we get calls from rural Maharashtra where people don't know the name of their village. It's that far in. And we get calls from NRIs who live in Oman. So the potential is there for innovation. It's there. You just need to get your hands dirty and research.
Is there any data to prove that the pesticides that are being used are creating more mental illnesses?
Well, simple answer is no. There is no data. That doesn't mean, I don't know if the answer to that is a yes or no, but to answer your question, there is no data of that kind. What we do have though, around pesticides that we know and which we need to do something about is the fact that nearly a third of suicides that happen in our country are usually with either pesticides or insecticides. So reducing access to means of suicide, which in this case is pesticides, is one of the easiest ways to actually try and bring down suicide rates in our country. And this is something that even the WHO talks about, reducing access to lethal means. And it's been tried in other countries where if you reduce access to lethal means, you actually bring down the suicide rate, because people do try suicide, but they might try it with less lethal means, and so people don't die. So pesticides and mental health, that is one straight intervention that we should be and could be doing.
I think I'm seeing a 2-minute mark from the timekeeper. So parting thoughts. You have a room full of philanthropists here. If there was one message that you wanted to give them, what would that be?
I'll go last.
I will start with you, Anand.
Difficult to give one message for mental health. I think it's a blue ocean. It's not a red ocean like RMNCHA, for example. Forgive me for saying this, but RMNCHA has become such a red ocean. So it's a ripe time to get into this field. This is the problem of today and tomorrow's India, non-communicable diseases. Again, quoting data from Gadchiroli, we have a verbal autopsy cause of death system. We find that stroke now is the #1 cause of death, then TB or malaria, etc. So India as a nation has rapidly crossed the epidemiological transition phase. Non-communicable diseases have become important. Global burden of disease clearly identifies mental health. So this is the right time, and at least for next 2.5 years, whatever we can do in Maharashtra, we are here.
Okay, so I think working in mental health has many stakeholders: psychiatrists, psychologists, counselors, activists, users, and everyone has their own thoughts on the matter. Some will advocate only medicine, some will say no medicine. So, I mean, what do you do? Where do you pitch? All I'll say is look at your values and figure out where you want to pitch. Personally, for me, I think the best approach is a rights-based approach, not a welfare approach. Mental health is a matter of human rights, and you must take care to build a user-centric model, whatever that may be. Yeah.
I was going to make a couple of really quick points which I would want you to think about when you go home. One is that I think you need to realize that there's a lot of social capital in our communities which you could tap into, especially when you're dealing with issues like mental health. So if you can think of combining social capital with the financial capital and NGOs like us who bring some kind of knowledge capital to the game, then that's probably the way to try and address the problem together. And the second and most important point I wanted to make to you was look at mental health as the way VCs might look at it, which is that you want to take, you want to decide where you want to invest. Do you want to invest early stage? Do you want to invest after proof of concept as Mariwala would like to do, or do you want to invest in a mature thing to scale it up? And really take the VC approach, which is try the experiment, and if you're going to, you need to realize that if you try experiments and innovation, you're going to fail. But it's okay to fail, and you need to allow organizations to fail. Fail fast, fail cheap, and fail quickly. And move on to the next innovation. And hopefully we will then finally find something that works at scale. But I think that whole VC approach to try and get this sector to move out of what has been a very traditional way of addressing the problem might just make a huge difference.
Great. So on that note, we'll close out here. And thank you so much for coming and sharing your thoughts. And thank you for listening in.